Hello, everyone. Welcome to the HIMSS Northern California Chapter's Digital Health 2022. This session is on how mixed reality is transforming healthcare delivery. My name is David Rue. I am the Global Chief Medical Officer for Microsoft. I'm a physician, a technologist, a health services researcher, and I've spent the past 25 years looking at how technology improves health outcomes. One of the most extraordinary and exciting types of technologies we've seen today is in the area of mixed reality. And for those that aren't as familiar with what mixed reality is, I think some of you are familiar with virtual reality, where you can wear a headset and it completely encloses you in an environment, a very immersive experience, but you really can't see what's going on around you. And in many ways, you could potentially bump into the wall or somebody else, but it creates that immersive experience, which is extraordinary. And then some of you may be familiar with augmented reality, apps like Pokemon Go, where you've got it on your phone and you can see something pop up and you can interact with it. Very interactive, very interesting, but perhaps maybe not as immersive. Mixed reality sort of fits in between. It's an ability for us to be able to have those type of three-dimensional images brought to life, but in an environment that allows us to be able to interact with the real world. And what we'd like to do is we'd like to talk to you a little bit more about how this can be done more in the area of healthcare and education, training, and delivery of healthcare, as opposed to some of the other traditional use cases. First, a little housekeeping. We will be doing a question and answer at the end of the session, but I encourage all of you to enter your questions into the Q&A section. Now, there's a chat and a Q&A, so make sure you enter into the right area. The Q&A, as you enter it in, just please put your name and the question and who you'd like to have answer it. It's actually going to be a critical part of today's session, because you're going to hear from myself and a couple of other outstanding speakers, but we're going to spend a large part of the time answering those questions. So that will be a big part. So please enter those questions in. And you also are participating. So if there's questions that you see in there that you like, please upvote them. You can hit there's a little field, and it ranks them higher. So a little bit of like social media liking. And that allows us to be able to get to those questions that are of highest interest first. So we're not going to be using the chat. So please don't be entering the questions in the chat, but feel free to converse. What I'd like to do is I'd like to introduce my fellow co-panelist speakers. Let me jump to the next slide here. Dr. Deborah Lee is clinical assistant professor. She teaches at the Adult Gerontology Acute Care Nurse Practitioner Program and is the co-director of the Clinical Learning Center in the School of Nursing at the University of Michigan. Dr. Lee practices in the Medical Surgical Intensive Care Unit as a critical care nurse practitioner at the Borges Medical Center in Kalamazoo, Michigan. So after I give a few opening words, I'm going to hand it over to Dr. Lee to talk a little bit more about some of the great work that she and her team are doing at the University of Michigan School of Nursing. And also joining us will be Dr. Melissa Bathish. Dr. Melissa Bathish is the clinical assistant professor. She teaches at the undergraduate nursing program and is the co-director of the Clinical Learning Center and Simulation Lab at the University of Michigan School of Nursing. Dr. Bathish is a certified pediatric nurse practitioner and also a fellow in the Healthcare Innovation Impact Program at the University of Michigan. And so again, what we're going to do is we'll share a little bit more about some of the experiences and things that we're seeing in the area of mixed reality relative to healthcare. And then afterwards, we will transition to some Q&A. First, a quick disclaimer. As most of you know, Microsoft has developed technologies that support the mixed reality in healthcare, but we are not a medical device company. We build these technologies. We hope our partners and our clients are able to take full advantage of the capabilities, but it's often up to them to be able to decide, is this something that will require a level of certification from regulatory agencies such as the FDA, and they take those with the understanding that this would be used in those very specific use cases. What we're going to be talking about here, in many cases, are art of the possible, things that we can describe how this could be used, but it really is going to be through our partners that will allow us to be able to understand how this could be delivered to you all. want to talk now a bit about what mixed reality, the potential that we see. This is a quote from my boss, or my boss's boss, Satya Nadella. When you change the way that you see the world, you change the world you see. And what we are doing with mixed reality is we are completely changing the paradigm of what does it mean to have virtual care? What does it mean to be able to interact with patients and have real-time access to information, and to be able to pull that information together in ways that we can both collaborate, but also manipulate in terms of 3D images. What I'd like to do is I'd like to show you one use case. It's an extraordinary video. It's a use case of a child undergoing a complicated pediatric surgery, and how the surgeons have used mixed reality to help support their pre-surgical and post-surgical planning and discussions.
We're here at Nicholas Children's Hospital in the Heart Institute, and there's a little 13-year-old girl who arrived from Haiti a couple of years ago who has a very, very complicated lesion in her left ventricular outflow tract and aorta, a ruptured sinus of Valsalva into her left ventricle, which is extremely rare, and the anatomy is extremely complicated.
So our goal for every one of these operations is to reduce the total trauma to that patient. And there are three critical structures wrapped around the defect in her heart: her coronary arteries, her conduction system, the electrical system of her heart, and the aortic valve leaflets. So I have to walk through a little minefield and not touch any of those critical structures and still be able to close this hole inside of her heart.
And being able to do a CT angio on her heart, print three-dimensional models with the Stratasys digital anatomy printer that we can actually operate on and cut and sew, we find that the technology is enormously powerful.
Now, I had been thinking about a different approach, and this model has just changed my mind on that.
And so even before we printed the first heart, we started looking for a virtual reality, augmented reality, now mixed reality solution. Found a wonderful vendor who's a full partner of Microsoft, VSI Appleclar in Germany, who has a fantastic mixed reality solution.
So I think the amount of information I can gather from multiple images that have different parts of the heart present or absent is profoundly useful. Are you Rosemary?
Yeah.
I'm your heart surgeon. I'm Dr. Burke.
Nice to meet you. How you feeling? Yeah, I can imagine.
Well, you're very beautiful. Nobody told me how pretty you were.
I don't think Rosemary understood what she had in terms of her heart problem until we gave her the model, until we showed her with the HoloLens exactly what the issue was. She's a very smart 13-year-old, beautiful little girl. She understood and understands why she needs open heart surgery now, and the surgeons understand better her very, very complicated anatomy.
I'm a little nervous, but at the same time not, because I know I'm in great hands and they're going to do a great job.
Basically, what I was able to do with the HoloLens is it gave me X-ray vision, so I could see inside the baby's heart, which we normally can't do. So that's like being Superman for a few minutes, and constantly remind yourself to be gentle to somebody's baby, somebody's child.
That's the fulfillment of what we perceive as our duty.
It's lower down, and it's like right about here. I have to get this stuff out, and it's right under the annulus of the valve. I'm just going to shut up and do it. This might be a game changer.
You can warm the room up a little bit.
It's real good. It's good room pressure. It's perfect.
The entire team does whatever it takes to take care of these children and their families to the absolute best of their abilities. And I think that shows in what we did today, why we form industry partnerships, why we're partnered with Stratasys for the 3D printed models, why we're partnered with VSI, Appleclar, and Microsoft for the HoloLens holographic 3D technology. I don't think anybody else in the world sees the synergy between these two technologies, the imagination and innovation and transformation that defines the Nicholas Children's Heart Institute that we've shown for the past over 25 years, I think is one of the defining aspects of the care that we give to these children and to their families.
So a couple of key points that I want to highlight from that video. The first was that the images come directly from the CT, MRI scans, and so they represent the actual patient images. So we have an ability to make this as relevant to the case as possible. This other thing that you may have noticed is it wasn't just the surgeon that used it. Rosemary, she had that headset on so she could see it. So patient education, helping to alleviate some of the questions, the concerns, the fears. This is something that can be done. And what we didn't see was even after the surgery, we can run the same type of analysis where we can do a post-surgical evaluation and compare the before and after. It's allowing us to be able to have better, more accurate, more precise planning, education for the patients, and also being able to provide an assessment tool afterwards. I want to talk a bit more about sort of more broadly. That was a fantastic example of how we can provide holographic patient consultation, working directly with patients and the surgeons and the clinicians that take care of them by presenting that information to them in ways that allow them to be able to be much more effective. The other area that we want to oftentimes see as being very valuable is having the ability to bring in other individuals, other clinicians and subject matter experts to be able to be a part of that conversation. We call that remote expert consultation. And using Dynamics 365 Remote Assist in conjunction with the HoloLens, we have an ability to pull other specialists and in many ways create a virtual team, even though there's only one individual. That can be done in a hospital setting, a clinic setting. We've seen some great examples of how this can also be done in nursing homes, where a headset is delivered to a nurse in a nursing home, and she can walk around and basically do rounds with the GP or the primary care doc, basically getting a 360 view of the entire environment. Far more efficient, effective than having an individual try to move to every place and see them themselves. And the other thing that we're starting to see is around training. And you'll hear a good number of those examples when we get into the work that's being done at the University of Michigan, education, training, and being able to do that in effective ways to allow us to be able to accelerate and bring individuals to a higher level of understanding of what needs to be done. Now, I'll tell you, when we talk about the concept of mixed reality, probably one of the very first things that people think about is the headset. The HoloLens and the HoloLens 2, incredible technologies, and you can see the capabilities it provides. But what's happening is that data is being generated, those images are being generated from the data in the cloud. And in this case, what we're talking about is Microsoft Mesh powered by Azure. And it's not just the HoloLens that is a part of it. So when we do the remote assist, you've got individuals that are on a PC or a tablet that are remotely logging in, and they're part of the picture. So it's not just about one device, it's about best of breed or best in class devices that all integrate into a common platform, and then applications are built on top of it. And that's a very important point, because as we think about the opportunity for us to think about what's possible with mixed reality, it will go beyond simply one headset or different types of headsets in a certain class, but it will be about how we can enable collaboration and coordination, leveraging this new platform. And this platform is going to allow us to rethink what is possible in terms of how we collaborate together. So with that said, what I'd like to do now at this point is, first of all, stop my share and introduce Dr. Deborah Lee from the University of Michigan School of Nursing. And Deb is going to share a little bit more about some of the great work that they are doing with regards to mixed reality. Over to you, Deb.
Thank you, David, for the introduction. And thank you to the NorCal HIMSS chapter for inviting us to speak today. We're very excited to share what projects that we're working on. I do want to start, let me share screen right quick here. Oops. Are you able to see that okay?
Yep.
Okay, great. So I wanted to definitely talk about, there's two mechanisms that are at the University of Michigan that have been able to support and give us resources that we really have needed to develop this project. One of them is the Center for Medical and Surgical Extended Reality, and the other one is the Academic Innovation Office. And both of them support our extended reality projects and research. So far, we have actually over 60 faculty members across 18 different clinical departments that are helping us. We also have multiple centers. So we have collaborations with the School of Nursing, School of Medicine, Engineering, the Dental School, and then also the Clinical Simulation Center, Center for Surgical Training and Research. So that has been crucial for us. We also have industry partnerships. So we have industry collaborations with Microsoft, GigXR, Wide Awake VR, Axon Park, and others. And then we have several faculty that have actually gotten new grants, both from NIH, industry sponsored, and then most recently is an NSF grant that we received to really advance the use of XR technology in healthcare to enhance delivery and quality of patient care. So the NSF grant that we just received actually is with the University of Maryland Research Park and Maryland Shock Trauma. And this is the first grant of its kind for mixed reality healthcare development in the United States. So we're quite proud of that. And this grant is with the contribution of Microsoft, GigXR, and some of our other industry partners. We've also received a grant also with Coursera, and we're developing 10 online courses that are going to start with putting mixed reality and augmented reality into the Coursera courses. And then also we're doing a fair amount of research here at the University of Michigan in the School of Nursing, looking specifically at Microsoft guides and developing how do we train our nurses and nurse practitioners using mixed reality. And so that's really what we're here to talk about. So as indicated in my bio, I've actually been a critical care nurse practitioner working in the medical and surgical ICUs for over the past 10 years now. And this role requires that I do procedures. So I'm doing central lines, arterial lines, intubations, and often I'm either teaching new providers or residents or nurse practitioner students. And I would love for them to view the critical components of the anatomy for that patient before we even start the procedure, and just review landmarks and areas that they could get into trouble with. So I think that this mixed reality has that capability. And as you're able to see from Dr. Rue's presentation, mixed reality really does blend the user's world with digital content in such a way that the environments can interact with each other. And so virtual objects behave as if they are in the real world. So MR is becoming increasingly more accessible to us in the academic institutions, has a lot more diverse applications that we can design and develop with, and obviously innovation that we're working on. So we're adapting and evolving how these advances can improve our patient outcomes. A majority of the training centers that we work with, and certainly here at the School of Nursing, does have experiential learning for the undergrads and grad students, but typically it's been, to date, standardized patients, it's been high fidelity simulators or task. So an example of this, like are the task trainers that we use for training the students. And as a result of COVID-19, we decided that we wanted to transition to mixed reality for training. So I am going to show you this next video, which will show you peripheral IV insertions and lumbar punctures within our center that we're working on with the students. You'll see there's holographic images. There's also directions for the students to watch. So we can put videos and pictures within the actual headset so they can be guided through their process. So let me show you this video. And basically you can see there that the Microsoft Dynamics 365 guides was the excellent, it was a great end user platform, basically for our research assistants to design training for bedside procedures and nursing skills. The guides initially was developed through Microsoft for use for automotive sectors and training workers on the assembly line. And we worked actually over the last 2 years with Microsoft designers and developers who then could help us create the 3D images that we need and also a medical toolkit to use for the healthcare sector. So notably, MR has been identified as an effective technology for experiential learning. It basically provides positive influences for the students' experiences, and it helps increase their confidence, their interest. Honestly, they're excited to use the HoloLens and learn a different way, motivation, and then overall satisfaction from the students. So we found that the students really like this advanced technology to develop their hands-on skills independently when they're ready to do it. And faculty really appreciate actually the standardized approach and the somewhat hands-off for them. They're certainly in the room guiding the students and helping them go through steps if they have questions, but it's not as intensive for the faculty. So to date, we've developed 12 different procedures that we use in our clinical learning center, as you can see on the screen here. And we do have an XR lab set up within our clinical learning center, so the students can come in pretty much anytime they want to work on different procedures. So maybe they were in clinical and they had a difficult procedure and they want to work on it. Or if they don't have confidence around a particular procedure and they know that they're going to need to do that, they can come in and basically it's mastery learning and they do it until they can accomplish and do it well. So last summer, we did want to talk about what we collected some data. We did in the procedures course for nurse practitioner students. We enrolled 24 graduate students in our study and basically had each one of them do a lumbar puncture. So the students went through traditional training. They had didactic PowerPoints that they looked at. They then came into the lab and watched a faculty member actually do the procedure and talk them through that. And then they would go into the XR lab where they would start to do the procedure themselves. And they could do it as slow as they want, as quickly as they wanted. They could keep repeating themselves. There is a branching within the guides so that they can say, did you feel like you were successful in completing this procedure? And if they say no, it starts them back up to the top, and so that they can continue to repeat the procedure. So 3 out of the 24 students we enrolled actually had used mixed reality before, so not very many of them had. And they had, like I talked about, completed their traditional training. I want to show you, this is what they actually see in their headset as they're working on the lumbar puncture. And we do have pictures to help them with landmarks. We have basically slides that tell them what they're doing. Here you can see the holograms. So they're understanding, looking at the lumbar spine, trying to find their landmarks to see where they're going to actually anesthetize and then ultimately do the lumbar puncture. This is giving them arrows so that they know what parts of the kit to be picking up. This is where a target where they need to be anesthetizing. So it really does walk them through each of these. We measured system usability, acceptability, and engagement in the students, and the usability was 76 out of 100. So if you know the SUS scale, anything 65 or higher is considered usable, and so we were very happy with that. We had, our acceptability was rated as a 1 to 5 scale, and we were at 4.51, so that was very high, and the students really liked the methodology. And then engagement also was very high. We were 8.29 out of 10 on the engagement scale, so very happy with that. All of the students were competency tested after their training. 100% of them did pass their competency training, and we were able to, based on faculty time, decrease the amount of time the faculty were actually in the CLC training by about 75%, so that faculty can then use their time to be doing, kind of higher end skills. So these were exciting for our research team, and we're actually excited to continue that development. So I am going to turn it over to Dr. Batish, and hopefully, let's go on to the next.
Thanks, Deb, for the introduction, and hello to everyone who joined us today. Thanks for being here with us. I am now going to share with you some of the things that we've learned while working with mixed reality on our specific project, including some of the challenges that we've encountered and future directions. As with any new technology, technical challenges are expected. And one that we experienced was related to the alignment of the 3D holograms on the task trainers that we were using that you saw. We discovered during testing that the holograms used in the guides did not actually stay accurately aligned between each of the users, which meant that we had to put the headset on and manually align the holograms between each student. And we had 3 HoloLenses going at the same time. So this did become a bit troublesome in terms of the extra time it took for us to do this, which we hadn't accommodated for in the back-to-back scheduling of each student session, and the need for additional IT support. But in all, it was a necessary step for us to complete so that we maintained reliability in the user's learning experience. Luckily, we had planned ahead and had technical support readily available during piloting, which helped us in keeping things on schedule. And in conversations with the students after they were done practicing their procedure in the HoloLens, the accurate alignment of the hologram enhanced learning, and when it was not accurately aligned, it did cause some confusion that took away from the experience. So in order to improve this moving forward, we will provide more pre-learning activities to teach the user proper wear and adjustment of the headset. So for this round of beta testing, we had students watch 2 Microsoft videos, which provided just a brief introduction to the headset. But in subsequent studies, we will provide a more comprehensive intro to the HoloLens device by using videos and tutorials along with some gaming activities to get the learners more comfortable with the technology prior to using it for training. We want the user to be more comfortable with the steps for signing into the device and opening the necessary guide, and the use of eye movement and hand gestures such as pinching, which will help the user align a hologram, let's say, prior to starting the skill, which will decrease the need for any external assistance from either faculty or IT. And the end goal, of course, being ease of use and trouble-free learner experience. As you saw from the first video that Dr. Lee showed, we also tested a 365 guide that we designed to teach peripheral intravenous catheter insertion with a group of 25 undergraduate senior nursing students. And surprisingly, we found that the usability, acceptability, and feasibility were rated lower than those of the graduate students that we tested. And in general, the grad students adapted to the new learning modality more easily and were more likely to adopt it as a learning technique. One explanation that we came up with for this preliminary finding is that graduate students are registered nurses who have already been out in the workforce, and they bring, with them experience in performing nursing skills in the clinical setting with real patients. So as more expert learners, they have automated a lot of the movements and patterns needed to carry out the nursing skills, which we think allowed them to just embrace the actual augmented learning experience itself. And then the more novice student has to focus also on, psychomotor skills and just getting the tactile movement right, in addition to working with unfamiliar, medical supplies and equipment that they haven't really used, all of which could impact their experience. But this definitely needs further exploration. We have found that there is a learning curve in the adoption of mixed reality technologies in nursing education, and that early exposure may be beneficial in acclimating learners to this mode. And having identified this in the upcoming fall semester, we plan to test the use of some 365 guides that we've developed to teach basic nursing skills, such as nasogastric tube insertion and sterile urinary catheterization, to introduce second-year students who are just beginning to learn their clinical practice skills and introduce them early to mixed reality learning. And we're hopeful that this early exposure in the nursing curriculum will improve adoption and become an integral part of their clinical education. And, since hands-on skills training in this way is very new, we are at a pivotal time in moving this forward and expanding its use in healthcare training and beyond. Fortunately, augmented reality is becoming increasingly more accessible, as Deb mentioned earlier, to academic institutions and healthcare training programs for enhancing clinical readiness and improving patient outcomes. So with that in mind and looking to the future, we are exploring ways to create a platform for collaborating and sharing all of the different 365 guides that we've developed. And our vision is to create a library for global use of skills and procedural training guides, and increasing the usability on cell phones and laptops as remote and digital education are becoming increasingly more common. So we have also been thinking about the availability and accessibility of the mixed reality technology and devices, and design ways such as a shareable repository for these to be utilized for learning purposes on a larger and global scale. So what does the future look like? And what are some of the things that we will be focusing on to move our work forward? We envision that the use of mixed reality will continue to grow and evolve, and especially as an extension of the high fidelity and the mid fidelity simulations that we currently do in our undergraduate and graduate programs, and certainly become a technology that will complement our distance learning and digital education programs. There are some areas for sure in the future that we think are important as we move forward in terms of measurement. First, in order to help us assess the inclusiveness of mixed reality in healthcare education, we want to collect information from learners about their lived experience with mixed reality learning and explore how it engages learners and its ability to support different learning styles. We will continue to measure skills competency, as we did in our pilot test, against expected standards with standardized grading rubrics to assess competency. We'll assess between an intervention group learning skills using the 365 guides for training, and then a control group learning the skills in a traditional instructor-led method to determine if there are any differences in outcomes. The exciting thing is that the use of 365 guides is scalable, and it can be used for learning clinical skills at different levels of proficiency and expertise. So extending the use of mixed reality to practicing registered nurses, for example, it would allow nurses to both learn new skills and to be able to refresh their competency for, maybe certain skills that they have not performed in a while. It could also be used for orientation purposes, so orienting new nurses to the hospital or a particular unit, and then for annual competency checks during what nursing refers to as the skills blitz. So with nearly 2.5 million registered nurses in the United States, the introduction of mixed reality for competency development and maintenance has the potential to markedly improve the quality of patient care and health outcomes. And it could similarly be used to train medical students and medical residents, basic and advanced skills and procedures. There are also opportunities for collaboration and global application. And we are currently collaborating with Health Education England to expand our efficacy studies and to partner in the development and sharing of successive 365 guides. And as part of the Pan American Health Organization, we will be introducing our 365 guides and mixed reality technology to multiple nursing schools in the Caribbean at a workshop that we're hosting in July. And we look forward to, even more opportunities for other collaborations in the future. But all in all, we are very, very optimistic that mixed reality is going to be a very key element in clinical learning and become a new norm in healthcare, education, and training. So thank you very much. I'd like to thank everyone again for joining us today. And we will now be moving on to Q&A, and we'll start with the questions that have the most upvotes.
So maybe if we start with the first question here that I see that has a thumbs up, do you have an interface to the EHR system, and how do you do analytics for the care? If you remember when I talked a bit about the underlying infrastructure that supports this metaverse mixed reality, again, we oftentimes think it is the headset, but it actually is the cloud. And with cloud computing becoming such an integral part of how healthcare delivery, we see, first of all, EHRs on the cloud. We see EHRs connecting to the cloud. There are APIs, there are FHIR interfaces. There's a variety of different ways that information can flow in and out. The data that we saw in those examples with DICOM images coming directly from the PACS machines, that's also coming directly from the cloud. So what we're leveraging is the fact that we have those levels of interconnectivity that allow us to be able to pull data and allow us to then resurface that up in ways that are three-dimensional images, as well as just simple representations. A couple of other interesting ways that people and organizations are accessing EHR through the voice. We didn't see some of those examples, but an individual can talk and it will respond to their command. So you can actually pull up a patient's medical record, their lab results, things of that sort, and have that all visualized. That's just a very nice, elegant way to be able to access the information in the EHR. Any data that's captured through those encounters, that can also be analyzed. And, again, because it's a cloud-enabled platform, you have an ability to manage that as you would with any other type of system. So great question. I think that's probably one of the areas that we'll see continued evolution, where we have an opportunity to leverage the fact that we've got tremendous data in these systems that can be surfaced up and brought to the point of care. I don't know, Melissa or Deb, any other thoughts on that?
Yeah, I don't think so. Great explanation. That was a lot of good detail.
All right, so why don't we go on? This one has 2 thumbs up, so we'll move that to the top of the list. What do you think the estimated costs will be for adopting and implementing mixed reality in the academic setting, clinical learning, as well as in clinical settings? So maybe that's a good question for Deb and Melissa.
It looks like we lost Deb here.
Okay.
So the cost, I'm trying to find that question. Estimated costs for adopting and implementing. Well, that's a very interesting question. Thus far, we've had some internal funding, but the cost associated with kind of the project that we've done in our particular center it's the cost of the HoloLens device, and actually it decreases cost or time for faculty. So we're kind of, a give and take on, the cost and the savings. So Deb may be able to add more about some of the specific budget line items through the Office of Academic Innovation.
So our project so far is about $25,000 in total cost. And it's really been supported, like I said, with grants. We won a Shark Tank competition on campus, actually, with the alumni. So that was a lot of fun. School alumni really liked our project, and that paid for 2 of our HoloLenses. We also had 2 more bought by grants, so it's about $14,000 in HoloLenses, and then probably about $10,000 in our research assistance to really build out all of the different procedures that we wanted. And then basically for Microsoft 365 guides is about $300 a year. So.
Well, on the topic of costs, I think it also may be worthwhile to touch base on some of the things that it's doing that go beyond what is currently possible today. One of the areas that we oftentimes hear quite a bit about that we are seeing as a major issue within every healthcare organization is that there are not enough nurses in the ICUs and critical care areas. We don't have enough physicians in a lot of these areas as well. Burnout being a key driver for that. And when you think about how they've been supplementing it, it either comes from 2 sources. One, you hire external folks, which can be very costly and expensive, but oftentimes it's about, sort of that farm system, bringing in the younger students and the junior faculty to help support. Now, if you're talking about one of the biggest challenges of now taking a junior nursing student and having them sort of manage complicated patients in an ICU, that's one where potentially these type of technologies can help accelerate the learning curve and also support them in the process. So I think there's a lot that we haven't yet explored in terms of what we may find as the real ROI for a lot of this, in terms of accelerating learning, in terms of being able to bring people to a higher level of performance and supporting them in complicated and very, potentially tricky situations. So I think we'll learn more as we continue to see a greater clinical use of these applications. Next question here. Do you have an approximate failure rate for alignment or related UX issues? Also, did users experience buffering or other lag latency issues? So great questions. I think that I'll take it sort of into 2 parts. The first, in terms of UX, it really does depend on the use case. A lot of the use cases that we have found, specifically as it relates to training and education, are in a much more controlled environment in which we're able to basically adjust and accommodate for a lot of the expected scenarios. When we get into some other scenarios where it's used in clinical practice, that's where we've found that there were additional requirements. We continue to have to learn more and see how we might be able to adjust the technologies to be able to help adapt to it. But it really is quite variable. And I'd say the education training element is probably the more stable environment because of the fact that you've got a much more concrete set of steps and things that require us to be able to control for a lot of those UX issues. Now, in terms of buffering and lag latency, we know that there's an opportunity if you're going to do things in real time, especially as you start bringing these images together. We have been working with organizations that are now moving to 5G. It's not a requirement for this, but the question was, could that help in certain scenarios where there might potentially be lag latency issues? This is just an area that we are continuing to explore, trying to understand, in certain scenarios, certain use cases, maybe this might be an area where we might be able to help address it. But as of today, all the things that you saw that we've demonstrated didn't really require a 5G. It didn't really have a lot of those lag latency issues. But perhaps I'll ask Melissa and Deb, in your experiences, have you seen any of those both related to UX and lag latency?
We didn't experience that. Yeah, no. And I think there was also a question about the failure rate at the beginning when we were trying to do the alignment. Again, that's a simple problem for us to solve, and it's just going to be giving the learner more pre-learnings and information about how to navigate the headset. That was the big problem. And so We realized that, and after we had gone through several cycles, the students were actually coming in to prepare to do their session, and they were actually watching what we were doing.
Yep. I'm sorry, Deb, I think you cut out on that. But yes, and I see that there's a question, Derek, you're asking from the chat window as well, related, this whole thing about midstream during a procedure. This is part of the reason why I said it depends on the use case. The use cases that we have seen most of the organizations focus on today are pre-surgical planning, education, training, pre-surgical planning, post-surgical evaluation, not really sort of this during the procedure having to do one of those. So that's part of the reason why we haven't really seen a lot of those issues, because largely the area of focus has been not necessarily as part of a midstream operation or procedure where it was sort of required that you had that real time. But that's a great question as well. There's another question here, Ali. Do you use any AI? If the AI is being used, please explain its implementation topology of it. So the images themselves being brought together into 3 dimensions is artificial intelligence. What we're doing is we are taking the actual the 2D images from the CT and MRI and reconstructing that into a 3-dimensional object, of which it's not just the picture, but the ability to actually manipulate that. So you can rotate it, you can expand it, you can dissect it, you can go in and explore further. And where it gets really interesting is in the Microsoft metaverse or mesh that allows you to be able to have an opportunity to collaborate. You can have multiple different individuals from potentially across the globe, all looking at this particular complicated lesion, studying, analyzing, providing commentary, one person actually walking to the other side, looking at it from different angles. It's extraordinary. It opens up a whole new arena in terms of how we can collaborate, because we're not just collaborating by sending a picture or sending some text, but we're actually have the live object in front of us. Deb, Melissa, any thoughts on that?
I was just thinking about the remote assist. I think that we've definitely shown proof of concept where we've had a surgeon here on campus in Ann Arbor helping and assisting with a surgery in another site. And so if there's complications or a surgeon has questions, they've gotten into the remote assist on the HoloLens and had experts help them through it. So
we've also thought about remote assist in terms of home care. So, if there's a nurse who's out in the field, and let's say, for example, there's some kind of wound that this nurse is not familiar with. So there are a lot of opportunities even for, training and learning on site, on the spot, as people are going out into homes to do healthcare there.
That's right. Melissa, while we have you, there is a question from Linda. Thank you for demonstrating AR's promise in surgery and training. How far do you foresee that it can become clinical use at hospitals and most nursing, even medical schools?
There's huge potential there. And that is one of the areas that we are very, very excited about, because like I said, with over 2.5 million registered nurses, the opportunity here is enormous. And, that doesn't even include probably 500,000 nursing assistants and all the medical students and medical residents that, could take advantage of this for training, learning purposes, for training purposes, for competency. Like I said, it could be used in terms of orientation. So new nurses coming into a hospital or a unit can, use these guides to help them, beef up on their skills. They can competency test them. We get competency tested every year. So they could be used in skills blitzes. I mean, I'm even thinking, long term, maybe this could be part of, the clinical ladder and moving up the clinical ladder in the hospital. So I think the field is wide open, and hopefully we'll get there.
Fantastic. I'm going to try to combine a couple of questions. They're related, and I think this again would be for Deb and Melissa. This one here is, how long does it take to create a mixed reality module like NG insertion? And then the question to Deb, thank you for illustrating various applications of AR in surgeries. In your opinion, what specialties of procedures likely could be widely adopted first? So maybe if either one of you could take one or both of those.
So interestingly, once the research assistants learned how to use the guides, they actually could do a procedure, create one in about 2 hours. And then we would review it, make any edits to it. Then they would put in the holograms, and then we would, test it with a couple students. So it's certainly within, a 4-hour period that we can get something up and running. And
for a more simple procedure, yeah.
Yeah. And then I would say, ultimately, our vision was to look at patient safety events within a hospital system and figure out if there was a procedure that was creating, iatrogenic or complications, could we go back and train those healthcare providers? The one complication that they see in England that I was quite surprised with was around NG tube insertion. They actually were having, insertions into the lungs and putting tube feedings into the lungs. And so we developed the NG tube insertion specifically for HEE and NHS. I do think the biggest areas that cross over are things between the residents in med school and the nursing, that we all teach the same. So central line, art line, intubations.
Peripheral IV insertion.
Mm-hmm. Yeah, but then there's so many different areas you could get into this. So
yeah, fantastic. A lot of great questions here. I'm just gonna randomly choose them here, right? Thank you for the compelling applications in physical care. Are there also AR, VR applications you have in development in behavioral healthcare?
So actually one of our faculty, Barb Medvac, is working on soft skills. She's really working with DNP students in rounds with the medical team and trying to teach students how to deal with difficult situations or conflict. And so she's worked hard at that within the AR platforms.
Yeah, certainly. I think that as we think about across AR, MR, VR, there are so many different ways that we can go beyond the telehealth visit to create an encounter that is, potentially allowing us to connect to the right individuals, but also giving us an opportunity to help therapeutically. I've seen many great applications in California in particular, where a lot of the virtual reality has been used to manage post-traumatic stress disorder by helping to recreate in a very sort of scaled approach so that the individuals can sort of get desensitized to some of the things that are normal triggers. I've seen use cases for VR for pain management and anxiety and things of that sort. So I think there's just a tremendous opportunity for, as we think about how these type of platforms can work together. And back to one of the earlier points, a lot of this is data that is now being brought and pulled together. It's maybe one of the few opportunities where we can start thinking about how we can use these as tools for both enabling greater collaboration, but also therapy, and to have data that comes back and allow us to be able to analyze that. We might be able to do some very innovative things. I'll share one of the partners that we work with out of Stanford that has leveraged the fact that they're using one of these headsets that allows for assessment of concussions and looking around eye tracking. And with that, it allows us to be able to quantify the level of concussion. We sometimes refer to it as a brain vital sign, allowing us to be able to capture that. And that type of information can be used to be able to assess and potentially predict prognosis. So really tremendous opportunities there. There's a question here about Do you think the reason we're not seeing these procedures is due to the technology constraints, or that the use case is less compelling than pre-post? I think it's a little of both. I think part of, first of all, there's not a huge number of the use cases that we talk about. The technology, the constraints really aren't as relevant or as significant. But as we start thinking about how we can apply this outside of the hospital, outside of the areas where we have more control over the devices and the scenarios, that's where we're going to probably run into issues. And I think that everything from access to affordable broadband, to be able to think about how the user experience, where people may not be able to be able to fully understand. So those things can be handled in settings such as hospitals and clinics and areas where you have trained specialists and with the infrastructure in place. But when you start going outside, that tends to be one of the major reasons why we see some of these newer requirements coming in, because we're starting to realize that we can push the boundaries of what's possible. I don't know, Deb or Melissa, you have any thoughts on that?
I know, and I think you said it well.
All right, this question looks like it's for me. Thank you for showing us such exciting AR technologies. Are there any parts of the technologies requiring FDA approval? Great question, and this ties back into one of the very first things I stated up front. Microsoft, we're not a medical device company. We have built some technologies that have extraordinary capabilities, allow us to be able to do a lot of things. There are some cases that will require an FDA approval, or some kind of a regulatory approval. And our partners have taken those applications and brought them to the FDA and gotten certified for some very specific use cases. So a lot of things that you'll see on market today have actually gotten those FDA certifications. And we work with our partners to be able to help explain how the technology works and be able to provide that level of documentation. But it really is based on the use case, and also the fact that the partners themselves are delivering on this. And I think that may be it, just out of time. First of all, I think this has been a fantastic discussion. You can tell there's a lot of exciting things going on in the area of mixed reality. We have been working at this for some time. I think there's a great opportunity for organizations that want to get more information and learn more about it by reaching out to us. We can certainly connect you with folks within our organizations that are doing things that may be related, and just getting things set up. I feel like sometimes the hardest part is just trying to understand how can an organization get started. So we're happy to share more in terms of what we're seeing there. With that said, on behalf of my co-presenters, Deb and Melissa, we want to thank you for joining us. We want to invite you to upcoming HIMSS events that will focus on mixed reality that are down the road. And we want to also have you think more broadly about how these can be applied in the area of education, training, and allowing us to be able to improve the clinical experience. Again, have a great rest of the day.